Hello and welcome to your national TV Doordarshan. We are here in the studio with Dr. Pewezo Kalo, a microbiologist by specialization, on a special interview session on novel coronavirus named COVID-19. The pandemic has widespread panic and fear, anxiety over health, economy, and affected lives globally. But at the outset, taking liberty, I would like to, on behalf of all of you viewers and the public of Nagaland, salute our frontline workers, healthcare workers, community leaders, volunteers who have stepped beyond duty to the response of this outbreak. As the COVID-19 ravages the equilibrium across countries, economies, developed or underdeveloped, there is another ugly aspect of the disease that has become evident, which is stigma. It is understandable there is confusion, anxiety, and fear among the public. While the COVID-19 disease is new and there are still many unknowns, and it is natural that we are afraid of the unknown. And unfortunately, these factors are fueling harmful stereotypes. So here is an interview with Dr. Pewezo Kalo to learn facts and scientifically about COVID-19 disease. Sit back, relax, and after all, it is not so alarming if we follow the guidelines. Doctor, thank you for joining us here at the studio.
Thank you.
We are much apart in this interview this time, but I'm sure we will have a very personal time, having this discussion, and I will strictly keep it to Q&A.
Sure.
Yes. Doctor, to begin with, what is coronavirus?
Yes. In this COVID-19 pandemic, many are aware of what the terminology coronavirus, and COVID-19. But for the sake of the public, I would like to clarify these terminologies.
All right.
As we know, that COVID-19 is the full terminology is coronavirus disease. Why 19? Because it was first reported in the year 2019.
Right.
Therefore, it is a disease caused by this virus called coronavirus.
Okay.
This coronavirus is also like a sort of flu type of virus. Yeah, it mostly affects our respiratory tract, especially our nose, our throat. Yeah, so this is the difference. And as we know, this virus is quite virulent and is causing this pandemic, COVID-19.
Thank you, Doctor, for giving us a good, clear description, explanation about coronavirus and COVID-19. Now, Doctor, what are the symptoms of COVID-19?
Yes. Many people have suffered that. Many people have these symptoms of COVID-19. But I would like to clearly point out that fever is there, बुखार हो जाए, इतो बीमारी लाई से वाला, खांसी हो जाए, खांसी कुरी जाए, आरो इतो अपोर्ट है, सांस लो बोले कमजोर हो जाए, नौले डूब पाए जाए, इतो तीन टा तो वाला main symptoms of this COVID-19. Besides, there are other minor symptoms like what do you call loss of taste, बाखाले भी taste एकु ना पा जाए, गाँव भी कमजोर हो जाए, एकु ना करे ले गाँव तो आउटली निशाना, कॉम्बा तो पे भी बिखा जाए, loose motion काम भी हो जाए, so those are some of the minor symptoms, but the above three are the major symptoms.
I see. Doctor, coronavirus to किनेगा spread होय, आरो coronavirus to हवा बराबर लगी बोले पारे वो नहीं के?
होय, अमेरिकन टीवी देखी आसे, रेडियो काम भी हुनी आसे, न्यूज़पेपर टीवी पढ़े आसे, सोशल मीडिया काम भी पूरा जाने आसे. और भी इतु बीमारी तो वाले mostly अमेरिकन ना ठुक लगा, नाले শ্বাসলা খাসি করে তানতে ইটু ড্রপলে পানি ছোট ছোট উলা যায় তাতে পরা পুকাবি ইটু পানিতে থাকা গেনে স্প্রে করে গেনে লাগি যায়
আচ্ছা
দ্যাট ইজ দ্য মেন ডিস্টিং কিনাকা লাগা লাগি হয়ে যায় ইটু আর নেই মাস্ক লাগাবি কয় সোশ্যাল ডিস্টেন্স রাখিবি কো আছে না আর মাস গ্যাদারিং না করিবি না ইটু খান ক্লোজ রুম খান টু ওয়েল ভেন্টিলেশন খান বাল্ব থাকিবি কো গেনে আমি খান স্প্রে করে আছে ইনফরমেশন খান
Doctor, can COVID-19 be caught from a person who have no symptoms at all?
Well, as per the studies, as the scientific report says, those who don't have symptoms are less infectious.
I see.
But it doesn't mean that it don't guarantee that it cannot spread. But it is more infectious to those people who have already developed symptoms. So we cannot say that symptoms nai, bimar samar ku nai, bimar to spread na hobo itu kotha du na hoy.
Acha, acha.
Spread korobole to chance to us.
Acha, acha. Doctor, what would be the incubation period? Suppose a person is exposed to the virus.
Yes, it says 1 to 14 days.
Acha, acha.
Means incubation period means say aaj apni itu bimari to lagi jaise.
Okay.
तो 1 to 14 days মাজতে আপনি symptoms কমবা ডেভেলপ হইছে তো টাইম লাগিয়ে পারা symptoms ডেভেলপ করে এটা ইনকুবেশন পিরিয়ড কয় বলে বি ইট ভ্যারিজ ফ্রম পারসন টু পারসন কমবা তো আজি বিমারি তো লাগি যাব কালি পরশো একদিন দুদিন মাজতে symptoms to develop হবলে চান্স বি আছে
আচ্ছা
বলে বি up to 14 days to le incubation period koi
acha acha so doctor what can I do to protect myself from the spread of this disease
well as we all know that how it spread so if you take certain preventive measures like say as I have said close contact for that matter we are keeping 1 meter apart, sitting 1 meter apart, something like that. Imam manu close na jabo lagi.
Acha.
It warni lockdown khan bhi laga diya ase to ami kan na. Eta. Number 2, mask lagabo lagi.
Acha.
Today gathering te ja ase, nahole bhi crowded place te nahole bahar te ja ase ole mask khan lagabo lagi. Then another is social gathering. Social gathering na tayo wala ya social program manu beshi jama kore itu kan tu na kore bola ge ite insana hoise wala na itu wala spread bi bon ho jabo komti ho jabo
doctor komba manu thake koe age group hisab te aro beshi severe illness due to COVID-19 hobo koi apni do olop explain kori dibo
well vulnerable age group khan bhi thake itu laga choto bacha khan aro 60 years and above khan besides itu oporte komba gao sao bimari thaka khan itu khan to vulnerable age group ho jay now ami khan as per the protocol 60 years and above khan to la takan na gao bhi immunity bhi kamjor ho jay gaula ta ko to kamjor ho jay etu warne itu khan to special precaution loy
acha
etu warne suppose returnees ho gena bahar jagana ahise we don't keep 60 years and above in the quarantine center as per the protocol but we have to send them for home quarantine and monitor strictly itu ase so itu age group different age group khan sai se we have to exclude those 60 years and above and children and itu majority be pregnant women khan vulnerable ase itu are to khan category of these people should take special precaution
okay doctor there has been our social media has been bombarded now but from a medical doctor like you it is better to get the information so I'm sure all the viewers also wants to get this answer as well so on behalf of all the viewers what are there any medicines or therapies that can prevent or cure COVID-19?
Well, so far, I said no.
Mm-hmm.
But one thing,
Mm-hmm.
there are certain things that you have to build up your immunity.
Uh-huh.
Because body's immunity is very important. It plays very important role in COVID-19.
Uh-huh. Uh-huh.
Once your immune system is strong enough,
Uh-huh.
yeah, then definitely if the virus enter into your body,
Mm.
definitely your body immune system will overcome the virus and you will not have symptoms
Acha,
or you'll
acha.
not have complications.
Okay.
That is one thing. Well, coming back to the medicine,
Mhm.
yes, there are certain medicines which are on trial basis
Mhm.
and it's marketing, but you see, in the initial phase,
Mhm.
so we cannot guarantee
Mhm.
that this medicine will surely cure the COVID-19. We cannot guarantee that. But there are other supportive measures.
Okay.
Like example, if a person is infected,
Uh-huh.
then definitely we have certain supportive measures, but those are all symptomatic.
Acha, acha.
So that is important.
So it's basically dawai nai etia hisab te do.
Ite hisabte hole dawai tu ase ami kobo na pare.
Aha.
Vaccine is on the way. Vaccine is on the way.
Acha, dear viewers, yare bishi interesting hoy ase. Dawai nai idubi nohoy. Doctor jodi komba bimar hoise gole do doctor hospital de jaise gole doctor khambra komba dawai tu cholai kine apnar ke treatment koribo edu karne jodi ekta manu corona virus lagise gole do hospital de jabe doctor logo biswas rakhibi doctor ta laga niyam ekta follow kore edu pura apnar ke treat koribole paribo moi jodi bimar hoise gole moi bi jaigine edu treatment hobo but there is no medicine as of yet because everything is on trial, and so the best method or the best way of prevention would be to stay safe, to stay home, and do not go to mass gatherings. Keep your physical distance and wear your mask. And we are maintaining the physical distance right here in the studio as well, so that we are free from transmission or infecting each other. Thank you. Well, Dr. carrying on with the discussion. So, what is the latest scenario of COVID-19 vaccine development globally, and what is the position of India as well? Vaccine.
Yeah. Age question specifically itu COVID-19 garni kona dawai tu na thake tu ami khan jani ase olebi apuni question na itu para hospital na hibo itu bi na hoy because there are other ways to manage the patient.
Yes.
Yeah. So that is one point.
Okay.
Well, coming back to vaccine, Russia is the first country in the world where the vaccine trials on human being is completed. So we have a high hope on that. Over and above that, so far in India, there are 3 indigenous vaccine under trial. So two are still in the trial phase 1 and 2. Then another indigenous one is in the trial 3 phase. If I'm not wrong, it started today or yesterday. Yeah. So this vaccine trial is going on everywhere, even in India, as I've said. So only our ray of hope is on this vaccine. But before it come to the market, it has to undergo trial basis. But we have high hope that sooner or later
something good will happen.
It will be available to everyone, and definitely there is the hope that will be free from coronavirus.
Right. Dear viewers, it is important to note here that despite the global scenario chasing or running for a successful vaccine, here is Russia announcing that as per our expert, Russia has vaccine and it has started using it. India is on the third trial, third phase trial. And so, countries across the globe are racing for an effective vaccine, and we believe and we hope that these vaccines will come sooner or later. But until then, let us stay away from this COVID-19. But if ever a person is infected, then it is not advised, it is not encouraged that the person hides, but contact the nearest hospital or the COVID-19 helplines so that they go to do the test, and if necessary, then they can go to the hospital, and the COVID hospitals definitely have ways and measures where treatments can be delivered as well. Well, carrying on further, doctor.
Yeah.
Should I wear mask all time? And you can imagine the situation when I say, should I wear mask all time?
Well, when we see the present scenario everywhere, it's wearing mask is like a sort of fashion. Let us fashion. Everyone is wearing mask. Yes, wearing mask is important, but not necessarily when you are at home or when you are alone in the room.
Okay.
But
Does
this
that
mask,
mean when I'm alone driving my car with the windows up, I can take off the mask?
not necessary to wear mask.
Oh, all right.
Now, wearing mask is important
Okay.
when you go to a crowded place
Okay.
or in a outside. But this mask is mostly for the frontline workers,
Okay.
especially the health workers who are taking care of the patient, who are having contact with the unknown distance status, unknown status person.
Right.
So this is important. Now, sometimes it is very pathetic to see that we see almost everyone in the town is wearing mask, but many people are not wearing mask according properly. That is one thing.
Right.
So just for the sake of wearing mask is not going to protect you. That is one thing.
Right.
Then another one is too much mask whereby all the people or many people see disposing mask becomes a big issue.
Yes.
Are
Yes.
we disposing the proper place? Are we disposing of properly? So therefore, I recommend that if at all situation demand, wear mask, wear properly and dispose properly. That is my appeal to the public.
Correct. Wear mask every time when I am in the public, outside of my house. But when I'm at home, it's not necessary for me to wear the mask. When I'm driving alone in the car with all the glass up, it's not important for me to wear the mask.
Yes.
But when I'm in the public, when I'm going in the town, when I'm going to the shop, I must wear mask, and wear mask properly, correctly. And the government of Nagaland Health Department has given us a lot of videos and advertisement telling us how to wear the mask correctly. Please, please don't forget to use your mask properly. Now moving on, doctor. कुत्ता पालिया भी खुशी पाए कुत्ता को ले नागालैंड तो सब हंसी दिया होले भी कुत्ता पालिया भी खुशी पाए बिल्ली पालिया भी खुशी पाए. So for all these pet lovers, is there any fear or danger of COVID-19 being transmitted from the pet animals?
So far, there was no reported cases.
Achha.
But if I'm not wrong, there is one case that the pet got infected from human being.
Oh.
So that.
Achha.
Now, my concern is, besides this COVID issue, we have to keep in mind that not only this pandemic time, but there are so many diseases that can be transmitted from pets to human being
Uh-huh.
and human being to pets.
Acha.
So we had to keep and rear them in a proper scientific way. That is
Okay.
what I would like to convey.
Okay, Doctor, I'm sure I have lots of questions and the viewers out there have lots of questions. But when a person is cured from COVID-19, ekta manu COVID-19 pra bal hoise, positive hoise, negative hoise, do they develop immunity?
Definitely,
Uh-huh.
it develops,
Acha.
or he or she, once they suffer, they develop immunity.
Uh-huh.
But doesn't mean that it gives you lifelong immunity.
Uh-huh. Oh.
As per the scientific studies, it says that once you are infected with coronavirus, it may give you protection for 90 days.
Uh-huh.
Beyond that, there is chances that you may get reinfected.
Acha.
Yeah. So
Doctor, time is running out again, but is it safe to receive packages from, couriers and all the things, parcels from coming out from COVID-19 reported areas? Yes or no?
possibility is there,
Uh-huh.
but many study has said it is not.
Okay.
Yeah.
Okay.
Including even frozen food.
Oh,
Frozen
yeah.
food. The
Uh-huh.
WHO says
Yes.
that frozen food package
Yeah, yeah.
don't transmit
And I'm
the
one
virus.
person who really enjoys frozen food. But if you are receiving any packages from outside, then be able to sanitize them before you open them and clean your hands. I think those are some proper manners that you can be more safe. One final question, Doctor. What can the public do to help the frontline workers and the medical department to effectively control and minimize the COVID-19 burden on health facilities?
Well, the public can do so many things, but one thing is that they have to follow the protocols,
Uh-huh.
standard operating procedures issued by government from time to time.
Mhm.
Because
Mm.
if the public don't cooperate by maintaining social distance
Uh-huh.
or encouraging the mass gathering,
Uh-huh.
then in that way we can't help.
Uh-huh.
How much the government or the frontline workers or medical staff can do,
Uh-huh.
until and unless the public come forward and cooperate by following the protocols. Now,
Acha.
if you follow the protocols, I'm sure, like how the coronavirus spread, how it can be prevented.
Right.
If you follow the guidelines, then definitely, I think it's not a big deal.
There's nothing much
Yeah.
to be
And
alarmed.
that will be the massive and major contribution by the public. And definitely
Correct.
that will lessen the burden of the government and frontline health workers.
Yeah. Doctor, thank you so much for coming to the studio
Thank you.
and sharing your expertise
thank
on
you.
this disease, which is really causing a lot of anxiety and confusion. Thank you so much,
Thank
Doctor.
you.
Well, at the end of the interview, there is one thing clear. We must all promote the importance of prevention, life-saving actions, early screening and treatment. The misinformation and rumor is spreading quicker than the current outbreak of COVID-19, contributing to negative effects of stigmatization and discrimination of people who have COVID-19, or people who are treated for COVID-19, or people who are recovering from COVID-19, and sadly, people who died after contracting COVID-19. Let us close with these thoughts. Stigma can drive people to hide the illness to avoid discrimination. Stigma prevents people from seeking health care immediately. Stigma discourages people to adopt healthy behaviors. Let us not share unconfirmed materials and photos, and let us share empathy with those affected. Thank you.